Okay, so welcome everybody. Welcome. Thank you for having me here. It's an honor that I'm able to speak here in front of you on suicide and suicide prevention. I'm Sebastian Scherr. I'm a full professor and chair in digital health communication at the University of Augsburg in Germany. And some of my research is on suicide prevention, and I try now moving forward to also to look further deeper into digital data, digital aspects around suicide prevention. I'm a professor in digital health communication for a year now in Germany. Before that, I was working at the University of Texas A&M University in the United States, University of Wisconsin, and before that in Belgium at KU Leuven, before moving back to where I'm from. Originally, I am from Germany. So, and today, I'm going to talk about suicide prevention strategies in Germany. So I'm kind of like doing two things today. The first part is I'm talking about the suicide prevention strategies of suicide in Germany. And the second part is an example of my own research that we just published this year, Journal of Communication, on a study where we did a newsroom intervention. So we worked, we produced an intervention for journalists, and we sent it out to all the newsrooms in Germany. And before and after we compared, we coded how the news media are reporting on suicide. And we coded the quality of suicide news reporting in those newspapers in which we also sent the intervention. And we projected this data against the suicide rate in Germany, which is kind of linking to what Professor Snowden just talked about. And we had quite some struggles to get the suicide data for Germany, which is a federally organized country, not so central as in Taiwan, unfortunately, in that sense here for suicide prevention. And we compared, how did the news report? We did an intervention for these news media. How did the reporting change? And what impact could we observe on the national suicide rate? That's the second part. So I'm going to jump in and talk about suicide preventions in Germany. It's going to be a quick part, just to give you a background of what is going on in Germany. So we don't have a centralized, comprehensive national suicide prevention strategy. It is more multiple larger initiatives, and they are not centrally organized. So these different initiatives in Germany, they are responsible for the suicide prevention. These are independently operating. Some of these carry suicide prevention, Suizidprävention in their name. Others is more the crisis hotline, the national crisis hotline. They're also tapping into suicide prevention, of course. And then we have foundations and alliances but their focus is more on mental health. So here for depression, for example. And then we have other mental health. So these are basically the two things. There is not one national initiative like in Taiwan. Mental health services, that's as a background factor, is usually covered by health insurances, but suicide prevention is not. So that could be a reason. So there is a focus on mental health issues because that people can go to their health insurance and that service is covered. So it's kind of like combined. In Germany as well, we have suicide data issues. I'm not sure if it's an issue, it's just a matter of fact. We have a delay of about 2 years. Access for, I'm calling it like regular people, including researchers who are not directly involved in collecting the suicide data. So there might be some medical people, clinical researchers who have earlier access, but I could not get access to data earlier than 2 years after the fact. I'm also not aware that Germany is publishing preliminary data like some countries do, as we learned today. I think the German mentality is that we release when it's final. We do it once. That's it. I'm not sure if that's a good thing because we have to wait 2 years. So there is no immediate response to a potential suicide crisis like during COVID. So we're still waiting for some of the effects that we observed in the last couple of years. So that's really an issue. The data is usually highly aggregated. So Germany aggregates the data up so that you cannot break it down, for example, on a daily suicide day rates cases, also due to data privacy protection. Germany does not want to give suicide data where you only have 2 cases on one day, because you could Google in the news media who that was. So, and then on top of that, you have 16 federal states in Germany, and they all are more or less collaborating with researchers. So when we asked for the data, some states were like, oh, sure, you can have it, and send over the statistics also, even at a daily rate. And other states said, no, 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 we need to protect the privacy, and we can only give you aggregated data per month, per week. So like higher levels of aggregation. That is a problem for research, because we have to compromise then at some point. We cannot look very detailed into the data. We have no systematic social media data. We have no social media monitoring. And we have also no monitoring of poison control centers. As we heard today, there is a large number of potentially hidden suicides in those kind of data, but it's not, I think in the US, they do a separate poison control. In Germany, they don't have that as a source where it's like, it's very frequent, or it's relatively frequent to have like self-poisoning, but it's not specifically pointed out as, for example, in the United States. And there is a lack of continuity in Germany, meaning that some of these initiatives that I mentioned, they get funding through projects, like it's project-based funding for a certain amount of years, but after the project funding is over, there is no continuity. So you need to have follow-up funding, and you need people who constantly write grants for this funding to have ongoing prevention. So that is an issue. We have also in Germany, there is regional variance in regard to how mental health services are accessible. So a typical problem, like between rural areas and more urban areas, there is a focus in Germany on crisis intervention and a lack of support, long-term support after the crisis. So postvention is not so much emphasized as intervention. So if I'm looking for grants in Germany, they would be more likely to give grants to intervention projects, but there is much less money put towards long-term support after a crisis. So postvention is like, there's a lack of funding in that area. Suicide prevention strategies are also not very much embracing cultural differences, which is a broader problem in Germany, where the largest group in society are predominantly white. However, if you look into the sociodemographics in Germany, you see that there is 22 million individuals, 27% with a foreign background. And those people mostly from Turkey, Poland, Russia, so East European influences, and there is cultural differences, and those are also not really acknowledged in suicide prevention programs. Germany in general can be considered as a relatively homogeneously, perceived as very homogeneous culturally, but it is actually not. So that is a lack. That is a typical thing, in my opinion, so that Germany is always a little slow. They wait, they like to observe and see before they jump in. They're not very quick movers. I collaborated with colleagues in Korea, for example, a couple of years ago before COVID, and my impression was the complete opposite culturally. Like in Korea, people were jumping right into that. They see a problem, they want to fix it right away. And Germans are more waiting, and like let's see what's going on. So that is probably true. Yes. So these are differences, and I think in general there is no, like here in Taiwan, there is a governmental budget that is allocated to suicide prevention. We're missing that. There is no such thing. So we really have to work. Suicide bereavement counseling and support for survivors is usually also here not covered in health insurances. These are like specific things. When you look at suicide prevention from a policy perspective, and you also mentioned that, Professor Snowden, that it is important how things are coded, because then you may or may not be able to talk to a health insurance. You also mentioned that in your response, right? So it matters what is a code, is it a suicide or not? And it's relevant for the families and the survivors, basically, if they get a financial compensation, if they get postvention covered by, and so on. So this is something also unique for Germany. These are some of the largest organizations. I think they would cover suicide prevention efforts in Germany most accurately. All right, so that's a little overview of Germany so that you get a feeling. This is the background in Germany with which we're working. And now I will move on to the second part, and that's a specific suicide prevention project. And I'm in communication, digital health communication. So I'm working in the department and collaborate with people in media, communication, journalism, research. So my focus here is how can we prevent suicides through collaborating with the media. And the media is that institution that reflects, that tells us about suicide. We know about suicide cases through the media. So what did we do in this project? We focused on the quality of journalistic news, and if there can be beneficial news coming from suicide reporting. The background, the conceptual background behind our project that we based our project on is Philip's notion of a Werther effect. So if the media report in a certain way, there can be imitative copycat suicides, and those are additional suicides that would not have occurred otherwise. So without the media reporting, these suicides statistically, they would not be observable. Later on, Niedergrotenthaler colleagues from Austria, from the Austria Suicide Prevention Group, they found a Papageno effect, which is the opposite effect. So if the media report in a responsible way on suicide, point out that there is help, there is crisis intervention, there is means you can go to counseling and where that is. If you show ways out of a suicidal crisis, the media can actually help to reduce the suicide rate. So we have two effects, like a detrimental effect, the Werther effect, and a beneficial effect, the Papageno effect. And the question is, how do they come together conceptually? How does that make sense? And in the media and communication and media literature, there is a notion of susceptibility, a susceptibility to media effects model that says it depends on the individual. It depends on the background, on psychological factors, how we perceive the media. The same media content can be interpreted by different people in a different way, based on our background and how we perceive it psychologically. So we explain that the same news article or news articles can have both effects. They can be harmful and helpful, but it really comes down to the people, how they perceive it, and to the quality, to the news reporting practices. And when it comes to the news reporting on suicide, a lot of countries, including Taiwan, have media guidelines on how to responsibly report on suicide. In Taiwan, that's something I learned during my stay here. There is a new law since 2019, and there's even a relatively high fine if you don't report accordingly, like $1 million Taiwan, I think. I'm not sure if any media company ever had to pay that fine. That's another question. But it is very explicitly formulated in Taiwan, so that's a very strong regulation. Other countries, including in Germany, there's recommendations, and most newsrooms, they would follow. If they don't follow, there is they have to correct themselves. So there is accusations from a media monitoring institution, and they speak, like they do a public blame, like we blame this news media, this news outlet for not reporting, and then they have to apologize, and that is, but it's not fined as in Taiwan. All right. So in our study, we did a repeated newsroom intervention in 2019. We contacted all the newsrooms for which we also had access to their entire news reporting. So that was the requirement for the study. So we need to have access to the entire reporting. We contacted 63 newsrooms in Germany for which we had access to their entire news reporting, and 22 of them responded to us. We then sent them a video. It was an online short video that we produced and evaluated in a previous study, a short video where I was the star of the video. I explain the suicide reporting guidelines in a short form in a way that a journalist would understand that, and gave some examples how it would look like if you write a suicide report. We also produced a text-based version of my video, of the same video, and we sent both as an online video and text-based intervention to these newsrooms who were willing to participate. So we knew when we sent the intervention to the newsrooms, and over the course of a couple of years, 3 years I think, we monitored the reporting in these newsrooms. We sent out an intervention twice during this time frame to see repeated effects. The quality we defined, and here's just some examples. I can share the more detailed coding instructions, the coding manual with you. The quality we defined as a high quality suicide news report avoids to mention the method or the location, for example. This is based on the reporting guidelines, and we assumed if people do that, if journalists do that we would see a decrease of worthless stories. So a potentially detrimental worthless story was defined as including these kind of information. And a quality suicide news report, in our definition, includes stories of hope and recovery, ways out of a suicidal crisis, and we would assume that if journalists do that, we would see an increase in Papageno effects, a reduction in the suicide rate. That was the question here. Is there an impact? If journalists follow our quality criteria, do we see changes in the suicide rates? And here I want to start. This is already results. So what did we find? This is here the descriptive findings on the quality in Germany. That is valuable because there is not many studies that give you an overview how much suicide stories can you find in a country. So based on our sample, between 2018 and 2020, we stopped the intervention like the same month when the WHO declared COVID as a pandemic. So our news reports are not including all these COVID stories. It's because that would be quite a bit of source of noise. So we exclude that, and we go back. So before the COVID times until December 2018, we found 4,000 articles in Germany that mentioned suicide somehow in that article. We excluded articles that is about political suicide or metaphorical use of suicide. So we hand-coded those articles and got rid of those stories. These are stories where it's actually about a suicide case. And we found that more than half of all the suicide articles are actually worthless stories. So these are stories that include method or location that are potentially detrimental. Only 3% of the suicide articles were potentially beneficial Papageno articles. So that's an important first descriptive finding. 35% of all suicide reports that we found included references to the method. 40% included references to the location. This is something the WHO media guidelines usually recommend not doing. So we find this relatively frequently, and on average, there were about 4 suicide stories in Germany per day. That's also a relatively high, I don't know, relatively, but it is a first estimate, I think. I have not seen other statistics about it. Yes. Yes. Yeah. 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 If it's in a different newspaper. Yeah.
How detailed was it about the information? Did the address, the city, or what?
That would count, but also when they say a lonely lake outside of the village, we would also say it is mentioned, it is a lake, and maybe in the newspaper, in the beginning they say Berlin, comma. So Berlin and a lake somewhere. For us, we had a very narrow definition, and for us that was enough, because our theoretical model was, if people hear there was a suicide and there was a lake involved, that could lead to copycat effects. That is too much information. An ideal suicide news story is very, very dull. There's not very much information in it, if anything, then more focusing on crisis intervention.
Regarding the location, the news report both the lake and Berlin, rather than only the lake without Berlin.
Yes. Yeah. And they would also, then you have a large variation also across, you could break that data down between quality news media, more tabloid news media, that is possible. And sometimes it's very specific, and they would tell you like an Autobahn, a highway exit in Germany, and they would tell you exactly where it is, and there is a bridge, and so you have from very detailed description to very rough or nothing, not at all, also possible. All right, so that's that part. And these numbers are relatively high for us, surprisingly high, that there is a lot of articles that are potentially detrimental, about half of all these articles. And for us, even more surprisingly, because a lot of the research in recent years is focusing on Papageno effects, and people are constantly trying to prove these beneficial effects. However, here we can put a quantifier on that, and it is only 3% of the stories that actually contains these stories of recovery, of hope, and help in a crisis. So these are definitely numbers that could be pushed through training of journalists, for example. It is not much right now that journalists focus on. When journalists report on suicide, it's usually the potentially detrimental stories. So people who have overcome a suicidal crisis, it's a very small share, and they less than one story a day. So these are really relatively rare.
Online,
Oh. Online and offline.
both.
Yeah.
The journalists in Taiwan would say why they rarely report Papageno stories is because of the worthy of the news. And also the online journalists want to have a high clicking.
Yes.
So they always want, to report a very shocking or sensational headings in the online news.
Yeah.
I think that's one part of the reason why it's so low.
That's true. On the other hand, you also remember, and that's also very click-worthy, you remember these stories when like a Hollywood celebrity opens up and talks about, I was depressed. A lot of people read these stories as well, and those are potentially topics where journalists could promote crisis prevention. So they do that as well. But I understand, like the argument is often, well, it's not so interesting if somebody overcomes a crisis. However, you also have these stories, like for celebrities, when they tell you, when I was 20. And so it is really about the journalists, they also need to be educated or inspired how they can also do work. That's something we've also learned throughout the project. Like if you just give recommendations and tell journalists, this is how you report, sometimes they just don't know how to do it. If you give examples and work with the journalists, you have a higher chance that the reporting actually changes, and that's my next part, that actually can have an impact on society. So let me show you. This was the descriptive part. So now let me move on to the quality, the distribution, and then the impact of the quality. So what we found is we had two interventions. That's this blue line here. We intervened twice, and we can see, or maybe you cannot see it in this graph, but this is the day of the observation period and the number of potentially harmful stories. And we analyzed this using ARIMA modeling. So we got rid of all the noise, autocorrelations, and we found that after the interventions, there was an immediate decrease of Werther stories. So the intervention led to the newspapers that got the intervention led to an immediate decrease, but the trend did not change. So we have a short effect, and that was repeatedly after both interventions. It went down, less harmful stories, but we didn't find a trend reverse, a change in the trend. So that's an important finding when it comes to prevention strategies. So you could turn this into an argument to say you need repeated interventions. The effect is short term. Why is that? Newsrooms change, leadership change, journalists move. So you cannot just do one intervention and expect the newspaper quality of suicide reporting to be up. It's a repeated effort, and more in the sense of a constant monitoring, so that you can see when the quality changes. What is the time lag after an intervention? How long is the effect of an intervention? So that requires a constant monitoring and possibly a repeated intervention. That's what we could derive from our findings. So we have a temporarily less published Werther stories based on our data. Another finding that is interesting, and that's part of the suicide prevention that can be relevant for suicide prevention, is if you look at those spike days. So there were some days where there were a lot of suicide stories. You see that here, right? So there's a lot of these days. And here in the top, you see the control. So these are newsrooms that did not get an intervention. So we had control newsrooms, and we had, here is the intervention newsrooms. And besides the fact that we have a short-term decrease of Werther stories across the board, what we found is that the number of newspapers or the days where they report multiple suicide stories, these peaks, they were not observable here in the intervention group. So the intervention leads to a less extreme reporting. So some newspapers, or on some days, there tends to be a large number of articles. In the intervention news groups, we did not see that. This could be explained through journalistic co-orientation. So a lot of newsrooms, they see the others, the competition is reporting. We should also do that. They get the clicks that we could have. And this effect was lower in the intervention newsroom. So maybe the awareness was higher that these articles can have such an effect. All right. Then the second part, the papagenos, or the positive articles. So what about the positive articles? Can the intervention, can they increase the number of positive articles? And here we found we had only 137 papageno stories of hope and recovery. And we didn't find any effect of our intervention. So we had the 2 interventions, but the number stayed the same, a very low level. So we can reduce bad articles, but this sort of intervention cannot raise the good articles. So maybe different forms of interventions are needed to change the writing into a positive and motivates people to seek help. All right, and now finally the impact. So what is the societal impact on the suicide rates? That's where we asked the 16 different federal statistic bureaus in Germany to give us their data. They provided the data at different levels of aggregation. We collaborated with them. It was a very much pain in the ass experience to work with them. We finally got this data, and what we found is here that in those regions on the left side where we did the intervention, we see that after the intervention there is the suicide rates were reduced. We find that there is a lower, less suicides in those regions where we had the intervention. So we tracked down where did we do the intervention, which newsrooms, where are they, where's the coverage, and we found a reduction of, on average, if you count it up based on the daily rates, that the news reporting, the intervention would save 17 lives if the quality would be higher. So the effect is observable, statistically significant. The suicide rates drop after the intervention a little bit. That
seems they are effective in a certain one. Downward.
This is the control. Yes, and there was no increase. So basically, in the control group, yes. Because we run out of the suicide data was not available. So the second intervention was close to the end of the observation period, and for that time we only have suicide data for the first intervention, which we did in 2019, I think. So when we wrote the paper, we only had the data available for that period. So that's exactly, we're waiting for the ops. Yes.
Okay.
And yeah, so that is basically the societal effect. Interesting, and following up on what Professor Snowden and you reported, in Germany it was really not easy to get the suicide data, and we also had to compromise. Here you can see the timeline. We had to compromise on that as well. because we couldn't get daily rates. We wanted to run these analyses with the daily data. That was not possible. We had to aggregate. So yeah, that's suicide prevention that we do in Germany. Thank you very much. This is where I'm from. This is the city of Augsburg.